Hello, my name is Pauline RN. Welcome to my channel. Today we're talking about documentation and we are on part 2. All my questions and answers are taken from RN Inklex Review. Please hit the like button, please subscribe, and please share this video. My first question, what is PIE? P-I-E. It's an acronym. Correct answer, P stands for problem, I stands for intervention, and E stands for evaluation of nursing. PIE addresses only nursing care based specifically on the process. What does CBE stands for? CBE stands for CBE. C is for charting, B is by, and E is exemption, charting by exemption. This is done like a flow sheet by the registered nurse. It charts treatments and changes of patients' conditions. What is Cardex? Is your next question. Correct answer, Cardex is a type of flip charting like a clipboard. It tells of all the meds, the treatments, and all the doctor's orders. It's a type of paper charting. Next question, what is narrative charting? Correct answer, narrative charting tells the charting of the patient from admission to discharge. What is physician notes? Is the next question. The correct answer, physician documents latest reports of improvement or decline of patients. What is graphic sheets? Graphic charting. Correct answer, graphic charting, we document our vital signs, temperature, pulse, respiration, blood pressure, heights, and weights. What are our transfer forms? What are our transfer forms? We use transfer forms in the case of patients who are transferred from one floor to another. We transfer from one hospital to another. Some patients may need to be transferred out to other hospitals. Some patients are transferred from the hospital to the nursing home, from the hospital to rehab. We use transfer forms to discharge these patients with communication from one nurse to the other. Which documentation may lead to malpractice charges? And the correct answer is incorrect time of event, failing to document verbal orders from the doctors, incorrect date, incorrect time. You should chart as you go along to prevent not documenting at all. To prevent malpractice, you have to document as you do your medications. You document every time. What do you know? Next questions about the documentation of your pressure ulcers. Correct answer, all patients are documented when they are admitted to the hospitals for pressure ulcers from the emergency room. We document length, width, depths of all pressure ulcers. We document when the patient come to the floor. If there's no document, you have to assess your patients coming to the floor when they are admitted to you on the floor. You have to document. Even though the emergency room did our documentation, you're receiving the patient. You have to document the drainage, the height, the length, the depth, the color, everything on that wound. You have to document your dressing if you applied any dressing. Please note, for pressure ulcers, the hospitals are financially responsible for all pressure ulcers coming into the hospitals, or pressure ulcers that occurred in the hospitals. The hospital is financially responsible. Next question, what is NDQI form? NDQI form, N is for nursing, D is for data, Q is for quality, I is for improvement. This is a quality improvement form. Nursing data quality improvement form. The NDQI forms, you also can put restraints on them and document the date, time restraints were orders, because it's a skin sheet, and when you restrain patients, they're at risk for skin injuries. That's why you have to assess them for tears and abrasion when you apply those wrist restraints on your patients. You have to document their skin circulation. Do your exercises on the extremities of your patients, because they can develop tears on their skin. So the next question is, you're on your DNR form. What does DNR means? DNR means do not resuscitate. What does DNI means? Do not intubate. If you have a DNR form, you do not resuscitate the patient. DNI forms mean you can try to resuscitate, but if your patients come back, you cannot push that tube in the throat and intubate the patient, because there is a DNI form there. The patients do not want to be intubated. It's okay to try resuscitations, but DNI do not intubate. For advanced directive forms, the nurse signs as a witness. For advanced directive forms, all patients coming in, patients and families should sign. Nurses are only witnesses. Next question, what is your medication reconciliation form? The correct answer, the medication reconciliation form is completed by all patients admitted into the hospital. From they come into the emergency room, they have to list on a form all the medications they are taking at home. The doses, the amount of medication, the time of day, once a week, daily, twice a day, 3 times a day. They have to list all the information concerning each medication they take at home. That's your medication reconciliation form, and it's a list of all the medications your patients are taking at home. And this list can be completed by the patient or the family, but when the patient lists all the medications, then the doctor will order medications so the patients can continue the meds that they are taking at home in the hospital if the doctor seems fit. So the doctor have to know what medications are you taking at home. This is why the patients are asked to complete a medication reconciliation list. Next questions, what do you know about your informed consent? The correct answer, the nurse is only a witness. The doctor is the one who explains the procedure, explain the blood transfusion to the patient. The doctor is the one who explains, tell the patient the risks, the benefits, and the alternatives. The nurse is the only one who signed. And remember, we have to have consent to give blood. Excuse me. Next questions, what does AMA stands for? Leaving Against Medical advice, against medical advice, is AMA. For your voluntary admission, your patients can leave anytime. We're not going to imprison them. But before they leave, they have to sign their form, because anything happens to them if they leave down the road, we are not legally responsible for anything that happens outside the hospital. So the nurse have to have the patient sign. A second nurse have to be the witness. The second nurse have to sign. The primary nurse has to sign. And the patient got a sign. We give the patient a copy, and the second copy stays in the patient's chart. That's living against medical advice. If the patient is admitted involuntarily, some patients are not allowed to leave against medical advice. They are in danger to the society and in danger of hurting themselves and others. You check the file, check with the doctor if you're suspicious, but some patients are not allowed to leave against medical advice. These are your involuntary admission. Maybe your suicidal patients are not able to leave AMA. They are at risk. They are in danger of hurting themselves and others. Some people are at risk for hurting others in the society. What does DNA means? DNR means do not resuscitate. A DNR form must be completed only by the patients, only by the family. The nurse is a witness, only a witness. So DNR means do not resuscitate. If you should come in and see me sleeping away and you can't wake me, do not resuscitate. Do not apply compression on the chest. What does DNI mean? Is the next question. DNI means do not intubate. Do not intubate me. Do not put anything down into my throat. Do not intubate me. You can resuscitate me, and if I come back and I have to live, I don't want to be on a ventilator. Do not intubate me. What do you know? Next question about blood transfusions. What do you know about blood transfusion? The answer is you have to have consent to give blood. If the night nurse gave 1 unit of blood and she hand off to you and said, this patient needs a 2nd unit of blood, the doctor ordered, I gave my 1 unit, you need to give your 2nd unit this morning. You have to look in the chart for your own consent. You can't go by what the night nurse said. So all blood transfusion, so long as you are giving it, no word of mouth from the night nurse, you have to check for your own consent. For informed consent, Jehovah's Witnesses, they do not do blood transfusion. They will not sign that blood transfusion is against their religious belief. In that case, you notify the doctor, patient refused, patient has the right. The doctor may just order iron or something, IV or oral iron or something, but the patient has the right to refuse. Okay, what do you know about registered nurses documentation is your next question. And the question they are looking for, the RN documents are own assessment. The RN does not document the previous nurse's documentation. Okay, if you come on to the day shift and you're documenting your assessments, Do not look what the night nurse documented on her shift. You have to do your own assessment. Do not copycat. Do your own, because maybe on the night nurse, maybe the lungs of the patient was clear, but you coming on, I always check lungs 1,000 times. Lungs can change in a minute. You have to check, do your own assessment. The lungs may be clear last night, but this morning there's wheezes, there's rhonchi, there's walls, and you would document the lungs is clear because the night nurse said the lungs were clear for her. And then within 10 minutes you come into the room, the patient is like dying, cannot catch her breath. You could be a COPD asthma patient, and because you didn't do your own assessment, you just document as per night nurse, the lungs are clear. This patient is in distress. You have to do your own assessments with your documentation. Do not do another nurse's documentation. Document your own assessment. Is this correct answer? Thanks a lot. Have a good day. Take care. Stay blessed.